So every single great nursing study, it all starts with a spark, right? Just an idea. But here's the thing. How do you take that spark and turn it into a research problem that's actually strong enough to build a whole study on? Well, that's the foundation we're talking about today, and trust me, we're going to make sure it's absolutely rock solid.
You know that feeling? You've got an idea, and it feels important. You just know it can make a real difference for patients or maybe for your colleagues on the floor. But passion, as great as it is, isn't quite enough. We've got to figure out if that idea is truly researchable, you know? Can it actually have a real impact? So let's figure out how to put it to the test.
I mean, inspiration for nursing research is literally everywhere, isn't it? It can come from a simple conversation with a patient, some frustrating process you see every single day, or even a pattern you spot while reading articles. But here's the catch. Those are just the starting points. The real work, the heavy lifting, is turning that raw idea into a focused, powerful research problem. And to do that, we're going to use a super simple but really powerful tool, a 5-point checklist. Think of this as your personal quality control process. If your idea can get through these 5 checks, you'll know for sure you've got something solid to build on. All right, first up, this one is probably the most important of all. Its significance. We're talking about the why factor. You've got to ask yourself straight up, why does this research actually matter to nursing? So a significant problem isn't just something that's interesting to you. It has to be valuable to the entire field. Let me give you an example. It's one thing to be curious about nurse burnout, right? We all are. But a significant research problem would be something like, how does a new scheduling model actually reduce burnout rates? Because see, that could improve nurse retention and patient safety. The point is, your research needs a purpose that's bigger than just your own curiosity. Okay, next on the list is feasibility. I like to call it the can-do factor. Look, an idea could be the most significant thing in the world, but if you can't realistically study it, well, it's just going to stay an idea. This is the big reality check, and honestly, it's where a lot of great intentions can hit a wall. You really have to think about this stuff. Do you actually have the funding, the equipment? Is your project something you can tackle in 6 months, or is it more like a 5-year beast? And what about people? Can you find and recruit enough participants? And maybe the toughest question, do you or your team have the skills to analyze the data once you get it? Being brutally honest with yourself here can save your project from being dead on arrival. All right, on to number 3, researchability. This is where we really start to get scientific. Your problem has to pass what I call the measurability test. In other words, can you investigate it and find an answer using actual data? So what does researchable even mean? It just means you can answer your question with real evidence. It's all about taking a kind of abstract idea, like improving patient comfort, and turning it into something you can physically measure. Think pain scores, patient satisfaction surveys, maybe even the number of times a patient asks for medication. It has to be something you can observe and count. Here's a great example to show you what I mean. A question like, should nurses assist with euthanasia? Well, that's a moral debate, right? You can't really collect data to prove it's right or wrong. But, and this is the key, you can reframe it. Instead, you could ask, what are the perspectives of ICU nurses on end-of-life care protocols? Boom, you just turned a philosophical question into something you can actually investigate with surveys or interviews. See the difference? So when it comes down to it, researchability is all about one thing: variables you can define, observe, and measure. Whether you're looking at patient outcomes, nurse satisfaction, or infection rates, your whole problem has to be built on things you can quantify and analyze. Okay, number 4, let's talk about clarity. Think of this as the final precision polish on your research problem. It's not enough for you to know what you're talking about. Everyone who reads your work has to understand it perfectly, with zero confusion. And all that clarity gets packed into your problem statement. Seriously, think of this statement as the North Star for your entire project. It's that one single focused sentence that tells everyone, your team, your reviewers, and even you when you get lost, exactly what you're trying to do. And a really strong statement is incredibly precise. It doesn't just say nurses, it says pediatric oncology nurses. It clearly lays out the key variables you're studying and the specific setting, like a large urban hospital. This level of clarity basically becomes the blueprint for your whole project. And that brings us to our 5th and final checkpoint. And honestly, this one is the most critical of all: ethics. This is the human checkpoint. And let me be clear, this one is absolutely non-negotiable.
You know, ethics in nursing research, it's not just some box you have to check off on a form. It's a direct extension of our core professional commitment to patient welfare. Every single part of the research process has to be built on that fundamental principle. First, do no harm. So what does that mean in practice? It means your study must be designed to protect participants from any kind of harm. It has to be something that can get approved by an institutional review board, the IRB. And you always have to be able to show that the potential benefits of what you're doing far outweigh any possible risks to the people who are trusting you with their time and their data. So there you have it. That's your 5-point checklist. Is it significant? Is it feasible? Is it researchable? Is it crystal clear? And most importantly, is it ethical? Just run your idea through those 5 simple questions and you'll know exactly where you stand. And hey, if your idea passes every single one of those checks, then congratulations are in order. Because you don't just have a good idea anymore, you've got a great research problem. So now the only real question left is, what are you going to discover next?